Central line dressing change and flushing. Just a bit of background. 80,000 to 250,000 CRBSIs occur yearly. The incidence in developed countries is approximately 1.5 to 6.8 per thousand catheter days, and in developing countries, it is estimated to be about 8.9 per thousand catheter days. There is a 12 to 25% attributable mortality. But did you know, it is estimated that 65 to 70% of CRBSIs are preventable with the implementation of evidence-based strategies. What is a central venous catheter? A central venous catheter, or a CVC, is a catheter terminating at or close to the heart or in one of the great vessels, which is used for infusion, withdrawal of blood, or hemodynamic monitoring. The great vessels include the aorta, pulmonary artery, superior vena cava, brachiocephalic veins, internal jugular veins, subclavian veins, external iliac veins, common iliac veins, and femoral veins. Central line-associated bloodstream infection, or CLABSI. A CLABSI is a primary bloodstream infection that develops in a patient with a central line in situ for more than 48 hours and there is no apparent infection at another site. Inform and counsel the patient. When entering patient's area, ensure sleeves are above elbows. Look for redness, swelling, discharge, warmth, and induration at the exit side. Take note of the PICC marking as well underneath the transparent dressing. After touching the patient, perform hand hygiene. Now, prepare the trolley. Get disposable gloves and Virosolve. Wear gloves before you clean the trolley. Fold the Virosolve wipe and wipe down the trolley. Ensure that all tiers of the trolley are properly wiped down before you actually prepare the materials on top of the trolley. Once you are done wiping down the trolley, dispose of your clean gloves in the yellow bin. Next, preparing equipment. Statlock 1. Sterile gloves, 1 pair according to the size. 3 packs of gauze. Extra packs of cotton balls. 10 ml of normal saline or 10 ml of heparin saline, depending on the type of central venous catheter you will be flushing. Transparent dressing at the appropriate size, preferably large. 2 blue needleless connectors or stoppers, if it is a double lumen. A pair of disposable gloves. 2 syringes of 10 ml or more if there's more than 2 lumens. And finally, the dressing set. Don't forget your face mask and your bottle of chlorhexidine 2% in 70% alcohol, also known as Steriprep. And finally, the blue tray. Put on the face mask before opening the dressing set and secure the tie behind the head. Secure the second tie behind the neck or just above the first tie. Perform hand hygiene before opening the set with alcohol-based hand rub. Open the set. Pull open the first flap carefully, then use the forceps to open the other flaps. Ensure that asepsis is maintained. Take out the yellow bin and put it outside the sterile field. Then rearrange the items within the sterile field. Take out the other forceps as well. Once done, dispose of the first forceps into the yellow. Take the yellow bin and stick it next to the patient. Pour the chlorhexidine in 70% alcohol first and ensure that it does not contaminate other areas. Then open up the gauze into the sterile field as well as the cotton ball. Open up all other materials that is needed into the sterile field. Open the syringes into the sterile field. Squeeze a normal saline or heparin saline into the container in a separate compartment from the chlorhexidine. Ensure there is adequate volume for the number of syringes and lumen that you need to flush. Also open up the stoppers into the sterile field. Don't forget, open the stat lock into the sterile field as well. Also open the transparent dressing into the sterile field. Finally, open the sterile gloves into the sterile field. Bring the equipment to the patient. Remove the old dressing first. Remember, do an alcohol-based hand rub. Put on disposable gloves. Start from the edge and pull the dressing towards the exit site very carefully. Be careful not to dislodge the catheter. Release the stat lock clips gently. And remove the old stat lock, peeling it slowly off the skin. Once done removing the old dressing, remove the disposable gloves and dispose of it into the yellow bin. Check the exit site again for signs of infection and note the marking. Next, do a surgical hand preparation with soap and water or alcohol-based hand rub. Dry your hands by picking up the tissue from inside the sterile field, being careful not to contaminate the surroundings. Dispose of the tissue paper outside the sterile field. Then apply sterile gloves. Rearrange the items and prepare your syringes. Draw the 10 ml of normal saline or 5 ml of heparin saline and attach a stopper to the end. Prime the stopper by flushing a small amount and prepare all syringes as needed. Position the patient's arm and place a sterile barrier under the arm. If it is not at the arm, place the sterile barrier appropriately. Squeeze the cotton and gauze to dry, ensuring there is no excess chlorhexidine, as this may enter the lumen of the line when scrubbing the harp. Scrub the skin around the exit site with some pressure. Be careful not to dislodge the catheter, but ensure there is proper scrubbing. Clean the body of the CVC, moving away from the exit site. Apply the stat lock by putting the butterfly portion of the PICC or the CVC into the stat lock clip. Then ensure that it is secure in place. Attach the stat lock securely to the skin. Place a folded piece of gauze over the stat lock to prevent the transparent dressing from sticking on it. Then apply the transparent dressing. Ensure the dressing is stuck firmly to the skin. Once the dressing is in place, dispose of the old cap. Now scrub the hub for 15 seconds or 30 twists. Ensure that the gauze is not dripping excess chlorhexidine to avoid excess chlorhexidine from entering the lumen. Attach the pre-filled syringe with no-touch technique and flush with a push-pause technique. Do not flush until the end to avoid flushing air into the lumen. Repeat the same steps for the other lumen. Once done, dispose of all equipment into the yellow bin. Remove the gloves, dispose it into the yellow bin, and don't forget to perform hand hygiene. Clean hands with alcohol-based hand rub. If your hands are soiled, wash them with soap and water. Finally, mark the dressing with date of due change.